Good day, everyone. This is again your nurse Edwin. This time I will be discussing for you to be able to understand chronic kidney disease. Chronic kidney disease, also known as the chronic renal disease, is a condition that occurs when your kidneys don't work as well as they should to filter waste, toxins, and excess fluid from your body. Kidney disease progresses in stages, defined by your estimated glomerular filtration rate, or GFR or eGFR, and may eventually lead to kidney failure. Now, question: what is GFR? GFR is also known as the glomerular filtration rate, or the GFR is a measurement of how well your kidneys are working to clean your blood. Just as your blood pressure and cholesterol levels are important factors in knowing your risk for heart disease, your GFR is important in knowing your risk for chronic kidney disease. Your exact GFR, just to let you know, cannot be measured directly. Instead, there is this calculator that will give you an estimate using a mathematical formula that most closely determines your kidney function based on certain personal factors and your serum creatinine, which is the amount of creatinine in your blood. Okay. Now, what is estimated GFR? Your estimated glomerular filtration rate, or an eGFR, is the calculation that indicates your level of kidney function. So based on the result of the creatinine serum test and other factors such as your age, your gender, muscle mass, and ethnicity. So if your eGFR is below 90, remember this number 90, your kidneys may not be functioning as well as they should, and you may be at risk for kidney disease. So by estimating your GFR along with other blood and urine tests, such as the creatinine clearance, your doctor is able to diagnose kidney disease, determine which stage you're in, and track any progression. So knowing your eGFR is also important to managing your health at every stage of kidney disease. Guys, the goal of treating chronic kidney disease is to best manage your health at every stage, which can help slow progression and keep your kidneys functioning as long as possible. Treatment options for kidney failure include dialysis, of course, or a kidney transplant. Now, let's try to understand what are the signs or symptoms of kidney disease. One of the trickier aspects of chronic kidney disease detection is that the signs and symptoms of kidney disease occur late, after the condition has already progressed. That's the problem about this. In fact, CKD, or chronic kidney disease, is sometimes known as a silent condition because it's hard to detect, and most people at early stage of CKD are completely unaware of it. So it is very important in understanding the signs of kidney disease. While watching for late stage symptoms won't help with early detection, it is still important to be aware of the signs. Remember, you shouldn't wait for symptoms before you take any action. If, for example, if you are at risk for CKD or chronic kidney disease, you should be screened at least once a year for any evidence of chronic kidney disease. The earlier chronic kidney disease is detected, the greater the benefit of early treatment. So my advice is talk to your doctor immediately if you notice any of the signs and symptoms of kidney disease. Now, what are those signs and symptoms? First, changes in urination, including foamy or a bloody urine, more or less urine than usual, or getting up more at night to urinate. This could be one of the signs. Then fatigue. What is fatigue? Lack of visual energy or feeling overwhelmingly tired. Itching. Why itching? Because waste buildup in your blood can cause severe itching. And swelling in the hands or feet. Swelling can occur when kidneys aren't removing extra fluid over time. So shortness of breath. The same thing. Extra fluid not removed by kidneys can build up in your lungs. That's the reason why you feel shortness of breath, because there's fluid in your lungs. Pain at your back. Localized pain near your kidneys that doesn't change or become worse when you move or stretch. So these are one of those signs. So other potential symptoms of kidney disease are the following. One is high blood pressure, poor appetite, or nausea and vomiting, or you notice some puffiness around your eyes, especially in the morning, or it's like a swelling in your eyes. Again, okay, remember this. If you have any of the signs and symptoms of kidney disease, please talk to your doctor and get tested. Now, how is kidney disease diagnosed? So how it is being determined, or how it is being diagnosed, in other words. A simple kidney function test can help your doctor determine whether you have a kidney disease. After measuring your creatinine levels with simple blood test, your estimated glomerular or filtration rate, or eGFR, or estimated GFR, can be calculated using, again, your age, weight, body size, even ethnicity and gender. So your eGFR indicates how well your kidneys are functioning. An eGFR of 120 or less can indicate kidney disease. So usually your doctor may also perform other tests before determining a kidney disease diagnosis. So the GFR test results indicate the stages of chronic kidney disease. Each stage of kidney disease corresponds with an eGFR range. So it is very, very important to know your eGFR so you can make informed decisions about your kidney health. Now, stage 1 for chronic kidney disease. Usually for stage 1, there is a kidney damage but still with a normal kidney function, eGFR of 90 or higher. For stage 2, on the other hand, the kidney is damaged with mild loss of kidney function and in the GFR of 89 to 60. For stage 3, it has two parts for stage 3. For part 1, the kidney damage with mild to moderate loss of kidney function, usually GFR of 59 to 45. For part 2 of stage 3, the kidney damage with moderate to severe loss of kidney function, usually the GFR of 44 to 30. So possible stage 3 kidney disease signs and symptoms are the following. You'll notice low blood count, malnutrition, bone pain, or any unusual pain, and numbness or tingling, decreased mental sharpness, or feeling unwell. Now, let's go to stage 4. This is a severe loss of kidney function, wherein the GFR of 29 to 15. So possible stage 4 kidney disease symptoms and signs include the following: anemia, decreased appetite, bone disease, abnormal blood levels of phosphorus, calcium, or even vitamin D. And then the stage 5, or we call it as the end-stage renal disease, or ESRD, kidney failure and this is the kidney failure and this needs for dialysis or transplant. Usually the GFR is less than 15. The end-stage renal disease, or the stage 5, is called renal failure, is the end stage of kidney function, not the end stage of life. You have to remember this. So this is the end stage of kidney function, not the end stage of life. Also called as the stage 5 or of chronic kidney disease. ESRD indicates that both kidneys are no longer working sufficiently to keep your body healthy and chemically balanced. So if you haven't already decided on an end-stage renal disease treatment, discuss your options with your doctor so you can make informed decision when the time comes. So possible kidney failure signs and symptoms, what are those? Probably gonna have uremia, fatigue, shortness of breath, nausea and vomiting, abnormal thyroid levels, swelling in the hands, legs, eyes, lower back, and also a lower back pain. Now, this is the $1,000,000 question. How long can you live with stage 5 kidney failure? Well, there is no cure for kidney disease, but you have to remember there are treatment options for kidney failure that can help you live well for decades. Okay, so when considering kidney disease options or treatment options for end-stage renal disease, you always have to talk with your nephrologist about your preferences and priorities so that together you can determine which kidney failure treatment options will work best with your life. Most people, of course, I think that if not all, most people have the freedom to choose the treatment option that best fits their lifestyle and health needs, especially if the decision is made before reaching to end-stage renal disease, also known as the stage 5 chronic kidney disease. While kidney transplant is still considered the best treatment option for end-stage renal disease whenever possible, dialysis will likely be necessary in the waiting period before surgery. So what to consider when choosing a dialysis option? When choosing a kidney failure treatment, there are lifestyle factors that may help you and your doctor determine your best option. So the more your treatment fits your life, the more likely you are to stay on track and thrive. Again, this is your nurse Edwin, and I hope I was able again to share a better understanding on chronic kidney disease. Thank you, and thank you for listening.